Sure that it was
Yeah.
They just
looked
have
at.
feeling
Due
with
diligence, I
consistent
gotcha.
thing with it.
Okay, we will call the meeting to order at 6:05 PM. Welcome, everyone. We certainly have a quorum tonight, I see. Yes, we do. Okay. Is there any privilege of the floor that's been submitted for this meeting?
There is no privilege of the floor.
Okay. How about approval of the minutes? I believe they are in our packets and Carrie distributed them as well. Are there any additions or corrections to the minutes from March 21st?
I just saw one spelling thing.
Okay.
Addition should be addiction.
Where are you?
So
What
this
did you say?
is, you had mentioned, do you want me to?
Yeah,
point it
go
out?
ahead.
On the director's report under substance abuse, it would be the first line of the second paragraph. Just need to change that from addiction to, I have a habit of doing that.
Addition to
Instead of
addiction.
Yeah. We're not adding.
I make the motion then to move.
Second.
Any opposed? All in favor?
Aye.
Great.
And do you mind if I interject for just a moment? I should have done this at the beginning of the meeting, but I wanted to introduce you all to Hannah. Hannah Abram is our new scribe. She's our administrative aide here at the health department. And so she's going to be, leading or scribing the meetings, I guess, moving forward and handling all those administrative functions. So as we're doing the, motions, I mean, I'm going to help her tonight, but just kind of keep that in mind, as she's learning everybody's names.
So look towards her rather than looking down.
Hannah, do you want us to go around and say who we are?
That'd be great.
Would that
if you'd
be
like
helpful
to.
for
Yes, that'd be
note-taking?
perfect.
Okay. Do you want to start, Wolf? then?
Sure. Wolf Deercron, I'm a retired family physician. He was also medical director at the UNC Stroudsburg.
Eric Khan, pediatrician.
Erin Pender, dentist.
Betsy Kidder, internal medicine doctor, Chautauqua Center.
You know me.
Matt Hanley from the Chautauqua Center.
Also known Lacey, but I will take my second to just say we are so excited to have Hannah for the health department. She is wonderful. She will be the one, if you call the health department, you'll talk to her first. And she's just been a wonderful addition under Sherry's, help and guidance on onboarding her. So we're really pleased to have her. Thank you.
Yes. Here you go.
Mark Tarbrake, former county legislator and at-large member.
Rick Ketchum. I was a retired CEO from Brooks Hospital and happy to be here.
Bob Burke, I'm a family physician, former commissioner of health here, a long time ago.
And Hannah knows me. I'm Sherry Rader.
Did you used to work at Maple Grove?
I did, yes. Yes,
I called you many times.
Yes, you
just
did.
have never
Yeah.
Yes.
Thank you.
Okay. Thanks for that, Sherry.
Mhm.
So I believe we are at new business. And the first item is membership. Is that something you're gonna talk about?
So we have a couple of updates in regards to the membership, unless you wanted to talk about it. Okay. So Dr. Erlinson has stepped down from the board. So he just had decided to do that, and we went ahead and, I mean, it is definitely a loss for us. So he was into like soil and water and those sorts of good things, and I can see a tear slowly falling from Jessica's eye.
I enjoy all of you medical folks. I truly do. I need somebody who knows the dirt.
He knows the dirt. He did that very quietly and
Yeah.
without any of us knowing. didn't
He did.
In a typical Tom
Sure.
fashion.
So he served us for 10 years, a little over 10 years, and we did, Dr. Kidder and Lacey just signed a letter, thanking him for his service and wishing him well.
He was very complimentary of the board and everybody on the board.
So Sherry, we have, the county exec has to appoint someone else. He was at large or?
He was a member at large.
Okay.
So currently, we can have up to 11 members on the board. The minimum is 9. We do have 9. The county executive is in the process of appointing another member. So Ken Dahlgren, and most of you may be familiar with Ken Dahlgren, but he works with Roswell specifically on the tobacco use prevention. And so he's come to our meetings in the past. It's been a number of years ago now, but he's heavily, he's all things tobacco and just how we can improve quitting vaping, those types of things. And so we're hoping to have him come on board. He also, I can't speak at length on his CV, but I know that he has an MPH, and he's been with Roswell with the tobacco prevention group for many years.
And
a former county legislator. too.
former county
Okay.
legislator and has really broadened his experience to all things really kind of substance use. So he, yes, will come with a wealth of knowledge of some of the other environmental programs and things that we have. So we're excited about his membership.
So it does leave one open seat. The one position that's been a little tricky for us to fill is in the bylaws, it indicates that we need to have a member from each of the cities in the county. And so we have from Jamestown, we're covered there. In the city of Dunkirk, we don't actually have one. We've had some trouble kind of recruiting from actually the city. We do have one of you is from Fredonia. So yes, okay.
Yeah. Used to work in Dunkirk, but I don't volunteer on about 6 boards in Dunkirk. but That doesn't count for adders.
Right.
I guess if we could identify, if anyone has any thoughts about that, and can identify.
So the mayor is
someone.
new. She's been, just on board 3 months or so.
Mhm.
Maybe that would be something we could do as approach her. And I'm not saying mayor as such, but she might, have somebody that she probably has no idea that somebody from Dunkirk should be on.
Right, that is true.
Was Tom filling any expertise role on the board in his environmental expertise? Or is that not
Well,
a separate, that's not a category that we have to fill?
Right, so it's not a condition of the bylaws. However, I know, Jessica has expressed interest in, possibly even replacing someone like Dr. Erlinson, but then also a veterinarian, because in the past we've had a veterinarian as another position on the board. Again, not a part of the bylaws, but something that's kind of nice a person that's kind of nice to have with that knowledge.
We do deal with a lot of issues having to do with animals and, and what comes up in the summer and also the environmental side of it. That's huge for us. And it would be nice to have someone who had, that
Do
experience.
we know a veterinarian who lives in the city of Dunkirk?
No,
Yeah, Jessica.
I've been racking my brain.
So, and Jessica and I have talked at length too, in regards to this conversation, the representation of some environmental perspective, surely from the fact, and we'll introduce, well, not to this group, you all already have a good understanding, of course, of the public health approach to things, but we'll talk a little bit later as to how we are developing a new employee orientation And that's something that we're going to share a high level overview with you all tonight. And we'll also be using that orientation to work with our partner agencies within the county, because the other agencies don't often get the exposure to the public health department that I would like to see, and kind of our approach, because we really consider them, of course, a part of the public health system and the population health work that we do. So part of that you'll see tonight, but really part of that vision moving forward is that our sanitary code, everybody would be very well versed in what the sanitary code is, and that's really what you're here enforcing and helping us to develop and really help the community to understand in a more fluid and dynamic way. Because right now it's kind of just and sometimes almost, I don't know, I won't speak for Jessica's group, but can be an afterthought sometimes from the county level of things. It can get, kind of skirted in with some other things. So we are really excited to just have all of the expertise around this table and bring in whoever else we can to help us continue to really move this forward. I think there's a lot that we can be doing in the community that we aren't exercising all of that through the use of our sanitary code right now. So yeah, any of those voices that we could bring to the table to really help us set the stage for kind of beefing up our sanitary code would be wonderful. So any suggestions you have would be.
One of the things that has come up frequently that Tom did a good job on was the lake and what was going on there and what kind of studies and what was, and that's a critical issue for us. And so bringing someone on who has that level of expertise would be very nice, because it keeps coming up.
Two thoughts. One following up on that. There was a public forum at the Fredonia Opera House about the Sturgeon water situation, and there were two professors from the college that were quite knowledgeable, and I thought very unbiased. They were just trying to present information. I don't know that either one of them was Dunker.
They don't.
They don't, and I've asked both of them,
Yeah.
and they're not able to commit right now.
Yeah.
Okay, my second idea is maybe someone from water or sewer department in the city of Dunker.
I have not reached out, I mean,
And maybe if
We
it
can
went
ask
through the
the
mayor,
questions.
well, I mean, maybe again to the mayors, it going that way, because more I listen, you go on expertise. I mean, it's someone who's, really living it, and I don't know, it's just an idea, and I would presume that person lives in the city of Dunker.
Right.
So it might bring a specific expertise to the table.
That's a great.
So
yeah,
I
great.
throw that out, and maybe again, going through the mayor might be, an approach.
I would second that thought, especially if it's an academic person or an employee of the county. Because the lake situation is so tenuous that if we go with any of the partners who are around the CLA table, then everyone else's feelings are going to get hurt. So,
mhm.
but it's a great thought to have someone with the lake expertise around. So we can fill 3 or 4 more spots. We're looking to fill
That would
one.
not be a terrible thing.
We could request a bylaws change
Yeah.
if we want to make the.
And not
the
to
board
belabor
larger.
this, but then I'll just cross this off the list for later in the director's report. But yes, echoed and very glad to hear that you all are hearing and kind of feeling the same way about the lake issue. It's something that Jessica and I think have said, elbowed our way into the conversation a bit to say that from the county health standpoint, it makes a lot of sense for us to be at the table during those conversations for a number of reasons, including the fact that we are tasked with monitoring the application of herbicides in the lake themselves. So that's, well, not monitoring, but we have to do the test after the application for the water sources. That's what Emily does, right?
Well, it's technically the responsibility
Of
of
the-
the applicator.
But
We just
step it into it.
facilitate the samples being collected and shipped in a timely manner.
Thank you. Yes, knowing how tenuous it is, probably, yeah, that's not the state of the
Yeah.
So with just all those things considered, we're clearly in the mix of all of those things. And we will be headed to a lake symposium. So for any of you who are interested in that. the
Can we
county will
clarify
put
too, this is Chautauqua Lake
the- Chautauqua.
that we're
Lake.
talking about.
Yeah, the North, so Jessica's a North County gal, so she's making that clear.
So the lake is Lake Erie.
Yeah,
So,
yes.
A little bigger.
Yeah, yeah.
Right, but there are 5 lakes.
I know,
And
yes.
each of them has its own little story,
They
and we're,
absolutely do.
and we're stewards of them all.
Yeah,
And so there are people with water experience.
yeah. It would be great to
We
have-
really have to have someone keeping us up to date on what's going on.
Yes, yeah, I think that's wonderful. It's June 2nd is this symposium. There are multiple symposiums. But June 2nd is the symposium that is being hosted by the county itself, and it is really planned to be a neutral ground and territory to bring all of the stakeholders and some new voices to the table. It is open and free to the public. And there may be some people there too that, may kind of present themselves as an option to be on board. So I'll keep my eyes on that day.
Is that at the Harbor Hotel?
It is at the Harbor Hotel. And the time, I did not write the time down, but we can get you.
Meet and greet starts at 8:30.
Can you just remind us how someone becomes a member? Do we submit ideas? Does the county executive submit ideas and decide, like, what's the process for coming up with ideas and
You
making
can
it happen?
all of those things. So you can submit directly to us if we're your easiest point of contact, and we filter everything over to the county executive, and then he makes a final decision as to who he'd like to appoint.
June 2nd's a Sunday?
Mhm.
Yes.
Yeah.
Okay.
Sorry,
Where's it being held?
Harbor Hotel in South.
We can find the
Yeah,
details
there's a
on that,
nice
send them
flyer.
to you. Yeah,
Yeah, we'll share.
we'll do that.
Sorry, I kind of waylaid the conversation. Anything else about membership?
I don't think so.
Agreements to settle?
So you have just a single page front and back this time. We do have, again, public water supply violations with respondents failing to submit monthly operation reports by the 10th of the following month. So those are on the first page, and then on the second page, there are a few instances where folks have multiple violations, for not submitting monthly reports. And then the bottom one there is for also not submitting the appropriate sampling for nitrate monitoring as well. And then there is one violation of the ATUPA, the Adolescent Tobacco Use Prevention Act, which they are now shortening, and I'm supposed to call it the Tobacco Enforcement Program. So this is the last time it'll be seen on here as ATUPA. It'll now be Tobacco Enforcement Program. So the violation for that was that the facility did sell to one of our individuals under the age of 21 who went in and attempted to buy. This was a second violation for that facility within, so their first violation was in January of 23. This violation was in February of 24. So they did agree to pay the fine of $1,000 with the addition of the required $250 surcharge. So their total was $1,250. And since this is a second violation, the next course of action is we send proof of the first violation, proof of the second violation to the state, and the state then sends it to New York State Tax and Finance, and they look at potentially pulling the licenses for this facility to sell tobacco products at all and lottery tickets.
Close store.
It could, I mean,
Okay.
yeah,
It's a small store.
yeah.
And it's a new operator. I mean, price has even been 15, 16 months. But
Yeah, and actually, I believe this one, it may have also, even just within the week, changed ownership. You get any notification of that? There is, the one in our Canada machine, is that at this
No.
location? Okay.
No, this is a different one.
Okay,
I do know the measurement, yeah.
okay, that's all right, good. But we have got notification.
So, so that's what we have. We do have other violations pending. We have the next Board of Health hearing is later this month. So there's at least one, again, tobacco violation that's going to be heard at that hearing later this month. So next meeting, I will have another, facts and findings to report to you, and officer recommendations.
Great. We don't need to take action on any.
No, this stuff is all stuff that has happened. This is, yeah, these folks are, yeah, they've signed their agreements to settle, they've paid their fines and.
And again, just to highlight, so, because we don't get to meet so entirely frequently, that as we go forward with, into this new year, into 2024 and 25, and we talk about the sanitary code and we take a look at that together and kind of learn about that together. That is the opportunity that we have to really beef up. It's the enforcement really is more so around these types of violations. You know, under state public health law, we basically have a certain, enforcement fine maximum that we can reach or, you know, that we can't really exceed. And in our own sanitary code, we really aren't even kind of close to those maximum.
Well, and yeah, I mean, and truthfully, we don't have it included in the sanitary code. And that's, you know, something in the back of your sanitary codes that you had, there's the, Article 23, which is the fees for the different types of facilities. But those are permit fees. So it doesn't actually lay out anything about the fees for violations, which is something that I've been talking about. But I'm glad that we now have a little bit of settled Board of Health membership, so we can look at that and really make a dent.
I would refer to that as appendix and say the appendix is referenced to be a part of the document, because otherwise to change it, I think it might be a
Right.
process to change it.
Yeah.
So it's kind of sometimes what I've done is
Mhm.
a list of things that, you know, might change annually or every couple of years. It's just
Right. Mhm.
by reference.
Right, that's a much better idea than making it an article. Yeah,
Yeah.
absolutely.
But then you say and it's incorporated by reference, so it's,
Mhm.
but it could be, maybe an appendix can be changed in a different way than the document. So.
Right.
Yeah.
Which is a nice approach too, again, as we work on this together, because then, you know, if we don't want to go to the whole kit caboodle, you know, you can incrementally step into some of these increases and things, because it will be an adjustment for the community, of course. So we know that. So again, we want to give everybody a nice amount of time to really dig into the code and to get familiar with some of these things and then really start to, you know, make some improvements. So you'll have that context as we move forward in these discussions.
Okay, director's report.
Since I'm already talking so much, just keep going. So just keep rolling here. So a number of really wonderful things to share with all of you. First, I've been doing a lot of reflecting over this last month, as I've been sharing like with the team here that you know, it takes, I said, give me 2 years to be like the newbie in the group and in the team here. But really that first 3 months I've taken, and, you know, everybody compares any new role to a marathon, you know, really consider this a marathon. And that resonates with me because I'm not a runner, but I've run some marathons, and, you know, I do not run them well. So I tend to sprint things. I'm a sprinter and I come from a sprinting family. And so understanding, you know, you can't do that with this type of work, but there is an element of that you have to go out from the start line pretty strong. And especially over this last 4 years, this department has just been through so many major transitions. And so I feel like I owe it to the staff here to sprint a little bit from the finish line, just myself, to get up to speed with where they've been, where we're at now, and really where we need to go to kind of shore some things up. So they've kept me very well hydrated. They've provided, if we're staying with the running theme, they've provided some water stations along the way and some, you know, carb gels and things like that. So they've been wonderful. And I had the honor of getting to highlight one of our staff. So those of you who are familiar with Kathy Burgess, So right actually before Nurses Week, so that we just had recently, or nationally, it's Nurses Week. Right before that at the state association, so it's the Public Health Partnership and Public Health Association's big conference every year. And I nominated Kathy for a rural health, and public health community nursing award, and she was selected from everybody in the state. So it was like pulling teeth to get her out there because she was like, well, we've got so much going on with this and I need to stay here with the team because she's very much a team player. But it was a neat opportunity too for her to be able to highlight her team. They have a wonderfully dedicated staff of nurses who have stuck with her and this department through thick and thin. So that's been a wonderful thing to get to highlight. The other thing I wanted to highlight is the state initiative this year. So DOH always sets a state initiative that kind of falls outside of our 6 core services that we're really mandated to provide service area in. And it's something that's always attached to one of those, but they ask you to do this kind of in addition to the work that you get reimbursement for. So, do this too on the side. This just happened to be one near and dear to my heart and something that's already kind of happening with the other agencies in the county, specifically around green space initiatives. So improving the access to safe and equitable green spaces and natural resources in your area for everybody and to increase physical activity. So that's been a wonderful project that Sherry has been helping so much with. We have a public health educator, Bethany Abawa, who has been also kind of spearheading that effort. It has come together in some really wonderful ways, and we'll share more about it down the road, but just wanted to put that out there for you. So you'll probably hear about that in the paper and different things. We are working with getting out to all of the municipalities who will have us and just talking with them about their comprehensive plans, built environment strategies like complete streets policies, smart growth policies, and just really forging those relationships so that they understand that we are here as a department to provide technical assistance and support to them if they need letters of support to do these things. And Sherry and Bethany have gotten to go out to some of these meetings and they've come back, with some really great stories about these, town supervisors who this is a part-time after a full-time job that they're working all day. And it's, they're feeling inspired of, yeah, we have this one spot near, the creek and the river right there that people come and bring their kayaks all the time, but there's no real safe way for them to access that. And could we write a grant to get access? We're like, yes, these are the things that we want to help you with. So it's the little, it's those first steps, just that planning and that awareness piece for a lot of these towns and villages and municipalities that on their own just would not have the capacity to develop these resources and gain this expertise and knowledge on their own. So it's that first part of forging that relationship. And what we'll do is after we've kind of collected, basically done a needs assessment with all of them and mapped out where all of the different municipalities are on the spectrum, then a best practices guide will be developed for all of the municipalities throughout Chautauqua County, highlighting the different types of projects that are going on, and then really helping them to convene groups and know who the point people are in their other villages and towns that they can lean on when they're ready to do these projects as well. As part of that initiative, we've been working closely with Chautauqua Health Network. Lisa Gustafson has partnered with us, and we have taken, and I'll actually let you talk about this a little bit more, Sherry, but there's a Trails Passport if you haven't seen it, and we'll grab some for you tonight before you go. It basically is a little map. You want to go grab them? It's a little booklet and map that you can take and access all of the different trails within the very expansive trail system in Chautauqua County. There are trail markers and spaces. It describes which of, where the trailheads are at each of the trails. It's a really wonderful endeavor. So we kind of brainstormed this idea of how wonderful it would be to really boil this down and target children so that children can take part in this as well, because it's a pretty comprehensive little document. So we revamped the little booklet and we are working with a little pilot program with CHN through Chautauqua Lake Schools at Sherman. And again, Sherry came back with these wonderful stories of the wellness coordinators and the phys ed teachers who are just absolutely excited about this program. And we have gotten so much great feedback about it. In fact, they're already kind of planning for iteration number 2, which will include continued work with Jacob Bodway and the planning department. They have an app that they're building out, and we're also going to put some effort into planning for children and people with limited mobility and needing to use assisted walking devices, because some of our trails, parts of them at least, are paved and accessible for limited mobility, people with limited mobility. So we're really excited about this initiative. If this is something, we have lots of these booklets. If there's organizations that you think would love to hand these out or have them on our,
I have a race coming up
of course.
on
you
June
do, Dr.
15th. No, we run a triathlon here
Oh,
to raise money to get diabetic kids to go to Camp Onyasa.
Got it.
I have 150 people coming. I could put this in all the race kits
We would
for
love
sure.
that.
Yeah.
We would love
There's
that.
some for you.
Casadega has a triathlon.
There you go.
Also, I don't know the exact date, but.
Oh, yeah,
Another
yeah, Mark
place-
Wilson, yeah,
Oh,
yeah.
right.
Then,
Places like that.
sure, this, and we give them, they've got
Yeah,
a
it's
visitor's guide, they've got this, everything in one of these, sure.
That'd be great.
These are people who,
Who would
That are
love
out,
to get
yeah,
out.
yeah.
and they
Right.
would come with their families, they're coming from Erie and Buffalo and wherever
Yes.
else they come from, Cleveland, I mean, it's perfect.
Yes.
Yeah.
Yeah.
Great.
We would
And
love
we're also looking into, getting in touch with the fitness centers in the area to
Mhm.
have these
Sure.
displayed with a little kind of brochure
Mhm.
rack. So we're
Yeah.
working on that. Did you talk about the kids?
I did. I talked a little bit about that. I'll have
I don't
you.
have enough. I don't have enough to hand. them
Yeah,
to you.
because
This
we're
is-
going through, they keep requesting more. They're like, there's more kids that are.
So we'll pass this one around, but this is kind of a initiative where we took the Wegmans Hit the Trail passports and condensed it, and we are doing a pilot program with Sherman Central School and Chautauqua Lake Central School. And so what we did was we took the trails that are closest to those areas, the rail trails, and I'll pass this one around, but the idea is to get students of a certain age. So they did all of the elementary in Chautauqua Lake, and then I think 3rd, 4th, and 5th in Sherman. And so to present it to the kids as a little bit of a challenge. And so they go to 6 of the 9 trails that are in the booklet and find, so whatever ones are closest to you, find the trail marker, which is the same trail markers that you're doing in this Wegmans one. And, doing it obviously after school hours. So hopefully getting their families out. So their families are getting active and some exercise too. Once they complete 6 of the 9, then they can turn their booklet in to their teacher and we'll have a small, token prize for them. They're going to have, I know Chautauqua Lake is doing like an awards assembly type of a thing for it. And they have all of these houses. So you probably know, Dr. Pender, that they're competitions, whatever. And then anyone, again, that completes the book is also entered in to win a bike. So there'll be a bike as like a grand prize.
Yeah, and I don't know how this was unveiled at Chautauqua Lake. The kids are so excited. My kids came home every morning. They're like, "Are we gonna go to trail today?" Like when I wake up, I'm like, "Oh my God!" And every kid you'll see them at soccer and baseball, and they're like, "We're doing the trail."
Oh, that's great.
So I don't know if it was like an assembly or something, but the kids are like, just
so glad.
Taking it to heart.
oh my gosh, they're so pumped about these trails. It's great.
Chautauqua Lake School was so enthused when we met with them. We met with the principal, assistant principal, and then the 2 elementary gym teachers or PE teachers. And they were just like, oh, we're going to do this, this, and this. They had all these great ideas. And so I can imagine that they have just totally took this and run with it. And I know Sherman had asked for some extras, so we had to print some more just in-house to satisfy that need. But yeah, so we're really hopeful that this pilot program is successful, and then we'll slowly roll it out into the other schools. When I say slowly, I mean because let's take the city of Jamestown, for example. A lot of these trails are not within close proximity of those residents, and we want to give everyone equitable opportunity to do something similar as this pilot program. So the thought is that perhaps we could identify some parks in the city of Jamestown that people could walk
Mhm.
to, and put some markers there. And so, and then also in the city of Jamestown and different areas. So these are just big plans, big, ideas that hopefully, it'd be great if it all comes to fruition, but. just,
There's
thinking
definitely
outside the box.
opportunities. I mean, we think of city of Jamestown and a lot of population, not necessarily but there's definitely opportunity. I can think of a couple of areas, Allen Park,
Mhm.
Riverwalk.
Riverwalk,
Sure.
yeah.
There's a bunch of others, and I think definitely those kids. I mean, any kids, inner city kids, we can't call them inner city kids, Jamestown, not a big city.
Right.
They would love something like that.
Mhm.
Yeah, we think so. And that's what, it's just been so neat.
Yeah, that's a lot.
I'd love to be a part of, the team as they, feed this information back to me, and it's, equitability they're talking about, and the levels of intervention where we're talking about, intervening here at the school level and really bridging and leveraging, the connections with the schools there. And it's been really wonderful to see, and just something so positive. There just hasn't been so much, positivity that we could focus on, because all of our attention was directed in so many
Yeah.
areas. So we are really so thankful for the partnership of Lisa and CHN. They have jumped right on board. So wonderful things. And any of these ideas, please, shoot them to us in an email. We are excited to do some different iterations. Like I said, the limited mobility, portions of this as well. Make sure that, people in that community are able to participate. So
If I could just say one more thing, what's really great about this kids one is the larger version, we call the adult version, Wegmans at the Trail Passport, is really like you had mentioned, Dr. Berg, it's a big challenge to go to, I can't remember how many are in there, but it's like 60 miles in total if you do the whole thing. So someone that is new to physical activity might not, that might be a difficult, non-attainable thing for them. But something like this, the kids are coming home, like you said, they're excited, they want to do it. They're getting, maybe the families that maybe I really don't want to get out and do things, but once they, once it's introduced to them, so it's just a unique way to introduce new things to new ways of physical activity to.
So I have
that may not
another little
otherwise do it.
wrinkle to this, by the way.
Uh-oh.
I was at Ironman Maryland in September, and in my bag, was this letter from a kid in grade 6. Dear triathlete, you can do this, and it's written in like, pencil with mistakes and stuff crossed out. And it's from Chloe and Mrs. So-and-so 6th grade class. So I thought, this is a great idea. So when I got back, I wrote Chloe a letter and I said, thank you, and then I went and talked to the superintendent at Chautauqua Lake, and they're going to generate 120 letters for the athletes coming to go in their bags.
Oh.
Now, for the athletes, it's a bit of a kick, you get this letter from a kid, but for the kids, they're getting involved in like an event that's going on, and they're, having to write about, and so it all comes together, these, you gotta
cool.
just keep, it's gonna be cute. I can't wait to see. I mean, this was so funny, written in pencil with bad spelling and everything. It was
yeah,
very
but then
good
like
fun.
mile 10, you're like, all right, Chloe, I'm doing this for Chloe.
I know. It was fascinating. Anyway, we'll see what happens.
That's a great idea.
Yeah.
One other comment, I heard you mention Jacob Wardway, but I've heard him speak in a couple different places, and he seems like he's focused on what they're gonna be doing online. And I just wanna make sure that, and you said you're coordinating, but it just strikes me that so much of this could be done that way too.
Yes.
And, I think that's a great opportunity also that we can send elsewhere, because I met with Jacob probably, I don't know, a year and a half ago or something, because I went up to, it was actually a northern Vermont around Lake Champlain. I was on a bike thing for a couple of days, and I brought back some things that we saw online there. It was very, very inexpensive, but it also highlighted B&Bs and,
Yes.
food places and whatever. And it made like 3 days and drove down the lake and ended up in Burlington, but it was all just, and there were a lot of people out there doing it. It was just like some signs on the side of the road and a lot of website presence.
Yeah.
And that's all it was. And they were like, okay, so I said, that'd be cool. So we went up there and did it. It was like, there's not a lot to it, but it was fun. It was marked, found a map online. I was like, okay, go ride a bike. Yes, we do.
I actually had reached out to Jacob to see if we could somehow incorporate this into the app, and he didn't think that that was a possibility, because the idea was, instead of having to etch the piece of paper onto, or the etching onto the piece of paper, you would just take a picture of it and then upload it. And I think that there is an opportunity to maybe do something like that, but not necessarily directly with the app, the Greenways app. He said he would be happy to put like the logo and link it to something. So we do have a website presence with this booklet, but right now we haven't found a successful way to make it online. I would be the type of person, and a lot of people, I take my phone everywhere. I don't necessarily want to have a piece of pencil and a paper. Now, it does work great for the kids because most of the younger ones do not have cell phones. So, this paper product is good for that age range.
Or both, obviously. If we can get it.
Yeah, and so Jacob's original point was just that, because they had just gotten, in perfect timing, of course, I go to Jacob and I'm like, this is a wonderful idea. He's like, we just finished the engineering of the app like 2 weeks ago, Lacey. He's like, what happened? But yes, we've talked about it as putting it as an add-on extension to their app, and that we could find some grant funds or work with CHM with some of their funds to then, plug that right in, because I think, to your point, the multi-platform would be really important, for a number of reasons. So more good things to come, and as much as you can support this and again, share great ideas with us. This is in the planning and piloting stage, so we are open to lots of creative ideas. If you feel like we've kind of missed a target group or anything like that, we want to hear from you.
Can I just share one thing that came to my
Okay.
mind before you jump on? As you launch this in other schools, you might want to consider in the good weather months, spring and fall, asking the elementary schools to do a field trip for one of the first
Oh, yeah, that's great.
Mhm.
hikes, because not all those families will be able to go.
Mhm.
So
Right.
getting the kids out.
Yeah.
The other thing is, there's a whole economic side to this. The bed and breakfast places, you could list, you could engage them at listing them, and people do this, like you were saying. You start off at point A, and 30 miles away or 20 miles away, there's a bed and breakfast place. And you book, and this could all be, and they can make lunches for you to take, but this
Yeah.
is all.
Yes.
We thought about this many years ago with Rails to Trails, where you could start in Sherman and get to, Mayville, and get to Westfield, and get to Brockton and to Fredonia. There are all kinds of places you can stop, and they'd love the extra business.
Yeah.
And these are people with bicycles, and that families, and it's
Gonna spend money.
oh yeah, and it's also
Yeah.
the right kind of people to have coming through your community, because they're going to spend money and they're going to like it here.
Right.
Yeah. So
Yeah, and planning has been really wonderful to accept us knocking on their door and saying, hey, could we pitch some of these ideas to you? Because, of course, they talk so much about economics, and I'm like, let's talk about the health economics part of this too. We talk about health outcomes so many times, and the economics associated with that. But even that prevention and planning piece, and really building that into the infrastructure of who Chautauqua County is. And Jacob says all the time, it's over, 60% of the people that we poll for, these assessments and things that we do say that they come here and live here because of the natural resources and because of the activity and outdoor activity. So yeah, we're hoping to make that a more synonymous partnership and relationship with that department. So yeah, again, if you know anybody from planning department, or you want to put a good word in with Mark Dice for us, tell him that. I knock on his door all the time. He's probably like, all right, Lacey, I get it. You want to help. So to not belabor here, I'm going to try to keep moving through. The other thing, just to highlight about kind of the school relationship, if you haven't seen it, and I'll probably forget, but Sherry or Hannah, if you remember, I'd love to send an iteration of one of the school nurse newsletters that we send. So again, this is something that we've been talking with CHN about. CHN sends out a number of newsletters as well. So we don't want to be redundant or duplicate, of course. But there is a concerted effort that we are making as a public health department to recognize school nurses as an arm and an extension of the public health department. because they interact with and provide care for and intervene with the most amount of children on a daily basis, more so than we could ever reach possibly on our own. And very timely, I think it was in the Times, actually, that there was just a whole article written on really school nurses as public health practitioners and as public health professionals. So I felt like we were really ahead of the game there, making sure that's that relationship has been solid. But especially those of you who work with peds, you know how important school nurses are for us in terms of immunizations and just screenings, referrals, early intervention services, and things like that. So we really value our school nurses and have made a concerted effort to show them that. So the resource that we've developed is just an ongoing touch point of information that we feel is useful to them in a moment that they wouldn't necessarily have the time or capacity to go out and seek out on their own. We provide things like resources, printable resources that can be sent home in both English and Spanish. We've been providing those things about immunizations even. You'll see, we can send it over to you, but I've actually enjoyed reading through them too, because it also provides opportunities to access for like the social determinants of health. So food pantry information, clothing drives. I've learned so much through them. I love reading through it. Keeps me up to date on things too. So again, in that theme of nurses and schools, just wanted to highlight our concerted efforts there. So we've gotten really good feedback about that. The other thing, kind of moving on to more of the programmatic information here. The Dental Advisory Board met on May 6th. So I don't know how many of you are familiar that there was a Dental Advisory Board that we have, but Dr. Pender came and joined us in the middle of her workday, which we were really grateful for. For those of you who are familiar, of course, Dr. Birken, you would be the UB Dental Van. And yeah, Dr. Khan, do they come to Southern Tier? UB Dental Van? No, it's just peds, just Jamestown. So the UB Dental Van has served in Chautauqua County for a number of years now. They serve about 1,200 kids a year, specifically children who do not have access to healthcare insurance or dental insurance and are utilizing primarily Medicaid. And the van comes down from UB, is staffed with a professor or two and some dental students, and they're not in residency though, they're just students, right? Yeah,
Right.
And they come down and they do really supposed to be kind of primary prevention type dental work, but apparently they're doing everything, even extractions and things like that.
Yeah, they have 2 pediatric dentists who actually are on board at all times, so they're allowed to do the whole scope of pediatric dentistry.
So I actually remember this initiative when I was spent some time up at the state with the legislator and with former Senator Young. She really championed this at the state level and carved out some funding directly from the state level for the initial grants and services. So there is a necessity that there be support at the state level for this. But UB has recently transitioned and there are some new deans and things in the mix. And so as always, these conversations and these types of resources and programs come up for discussion. The UB Dental Van is one of those things that has come up for discussion. So we are kind of at what we would consider a critical point to ensure that we raise our voice and say this is a very valued and necessary service in our community. And if you are considering any changes, we would ask that the UB Dental Van not be one of those changes. We will see how those conversations go. We will let you know if anything should change. I'm a planner. I come from a public health planning background. So we pulled the Dental Advisory Board together to start with some contingency planning should something change with the UB Dental Van. We also called as part of that meeting Cattaraugus County Health Director and Allegheny Health Director, because really they serve kind of that Tri-County area. So they are also on board with supporting efforts to ensure that there's some type of universal access to pediatric dental. So we also wanted to make you all aware of this. if you have thoughts or opinions, if we are going to put together an advocacy letter, if that's something that you all in your practices would like to sign or other physicians or local support that you feel would like to sign that, we would certainly appreciate that. And we are considering pulling a meeting together, or asking for a meeting with the new dean, and Senator Burrell has also said he would supply his support for those conversations as well.
Lacey, one of the things, I've been here long enough. When I came to the area, dental van went to different neighborhoods, schools. And this might be time to look at the mission. The kids are at the preschools, Head Start, at the schools. So when they are here 5, 6, 7 weeks, if that continues, another pitch could be they'll spend a week in this school, next week here, kids coming to school. They'll touch a lot of lives, and then maybe approaching schools for letter of support. At the state level, there's a lot more pull when there's, of course, community supporting letters. But because we're talking about kids' dental health, if the school districts are, superintendents are writing a letter of support,
Yeah,
I think that will go a long way.
yes, great idea. Yeah. Yes, there's a reason why when I lived in Albany, all the tourists would get off the bus and take pictures in front of the education building. It looks a lot different. It's quite a large building. And it looks more like the other Capitol buildings. I'll give them that. It's got the white pillars and all of those.
There's a superintendent's association
Yeah.
that meets, so, you know, something, but, you know, going to one instead of going to, whatever we got, 19 or something.
Right,
Uh,
right.
Maybe that would be a way of.
Yes.
Just to
I don't know
raise,
if they meet in the summer, so it might be something to do fairly soon.
You know what, and I know the county executive does attend every once in a while, and he is fully on board. He actually attended the meeting with us too, because he's very concerned about this, so I'm sure he'd even be willing to take that meeting and ask for that. Yeah, right.
just to raise awareness too, like all health professions, our county, we are super deficient in dental health providers across the board, hygienists and dentists. So the UB, what they have with 2 committed pediatric dentists is we really need to fight to keep that, because a replacement for that, there's a lot of challenges with the dentists. But then they have this pipeline of students that come in, and the students come in and they provide hygiene, they're providing services under the supervision of these dentists. So it's just this great, I mean, I think there was 1,500 unique students last year. That's 1,500 students who probably will never see a dentist because it's too hard for transportation to an office, or there's pretty much no offices that are taking new patients that have Medicaid with our pediatrics. It's tough to treat kids if you don't have a specialty. It is super alarming. So I think, you know, there are alternative options, but really trying to keep this UB mobile unit in our county is really, I think,
And
the
it's
ideal.
exposing a lot of students going into dentistry
To
to
our
Chautauqua
county.
County
I
where
know.
they might want to come.
Right.
Mhm.
Yeah, and I think, you know, the person who runs the mobile unit, it's a big load. I think we could work to help take the load off and work with the schools as a county to help signups and raise awareness, because the numbers kind of dipped. So we could do a little more with logistics on our end, but we really need that mobile unit to be here.
So how is the funding work? Was it funded by?
So they are now, and for the last handful of years, funded by a Mother for Bernie grant that the grant operator and the facilitator of this outreach program, she wrote for herself. Again, where this has kind of come onto our radar is that she may not be with the program much longer. And so this was kind of her heads up that like, hey, a lot of this is kind of relied on me. Initially, the startup funds for the infrastructure and the actual vehicles, there are parts of it that came from state funding, which is where Senator Burrell has said, okay, well, then we're going to wait a second here because, and just, public health 101 is, we've learned from those mistakes that you don't build infrastructure into a community and then not help sustain it and, and then tear it away. I mean, how many of those research projects did, you learn about when you go through those FBH programs, you don't take them. So something that I have been very encouraged by, though, to see the response from the leadership and, Dr. Pender was willing to come out, people that we recognize what, this could create, for our kids.
What about something from the Board of Health?
Be wonderful.
I think that would be
Mhm.
very important. This is an intervention. If you don't make it at that point, you know what you get later on. You get the adults who have no,
Mhm.
no access to care, who have,
Yeah,
you know what
dental pain leads to
Oh,
many things, addiction,
of
many things.
course, of course.
Cardiovascular, yeah.
The whole thing, yeah. So,
And it would be wonderful too, should it get to the point that we need to call a meeting with the new dean to have some representation for the board. It would be wonderful to do it. So, and we would make that soon, so, so that we wouldn't have to, get you out there.
When you think of that Mother Greenie Foundation, they're hundreds and hundreds of millions of dollars. So I wonder whether this person who has written the grant, or someone else, I'm not saying it's never as simple as just asking, but I would think if that's one of the real concerns, because a person who's the grant writer, maybe there's a way around that too. I mean, we gotta get the grant application in, because I expect it's a multi-year grant. So if it's a, 2-3 year grant, then, okay, what's the deadline to get it filed? Is this person filing it, or do we need somebody else to write it so it gets filed in time? So we don't lose it because somebody resigned or retired and well, nobody submitted it.
Yeah.
So I think,
with the appropriate support documents.
Yeah,
that
yeah,
we
for sure.
generate from the school superintendents, from the Board of Health. Sure, that's,
so I don't know what the timeline is when this current grant expires, but it strikes me that if Mother Cabrini's been supportive in the past, it would seem like a real logical spot before we start talking about the Wilson Foundation or this or that, other big ones that are possibilities. But Cabrini's got that permission to
Mhm.
do this.
Yeah, I think the Getty Foundation helps support, there's some local funding too that helps support that mobile unit directly in our county. But, we didn't get a lot of paperwork on a breakdown. It was all word of mouth. So I think what we need to do is actually see some physical, where is the funding? How much is it? What expires?
That's what yours.
Right.
What it is,
Exactly.
deadlines and
Mhm.
applications.
How much it takes to run exactly that unit.
and it may be a patchwork of grants that you're
Mhm.
saying, and they may not all fall. So you gotta have to look and see what,
I think
Yeah.
the conversation with the dean would be important,
Mhm.
because it may not be, as it happens, it's his pet project, he's the new person coming on. Or as voiced around the table, that it could be grant writer situation. So I think as we collect information and data and gearing, conversation with the dean of dental school is important. See what the obstacle is, or why they're ditching it.
Right. Okay, wonderful. Thank you for the support on that. Speaking of units, the mobile health vehicle for the health department, as you know, it is completed its final stage of review. That's a joke. That's an inside joke for the mobile health group here. Yeah. Yeah. What Kathy Burgess is heading up really kind of a pilot initiative summer with the vehicle, so that we can really develop some of our own best practices of how to use this. She's going to basically employ some of our core services, some immunization pods and things like that, setting up at the school. So I'm working with the local schools for that. I know in discussions too with TCC to ensure that we're not, again, overlapping or duplicating, but that we're, really manning all of this together. She's gotten some great responses about that. So there will be information forthcoming that actually we'll send out to all of you that you can share. So there will be regular dates and some regular locations. Love School is one in particular that we really wanted to have a presence in that community, specifically in those couple of blocks. Dunkirk Schools will be a location, and then some of our rural areas, a church parking lot in near Brockton, Portland, I want to say. So there's a nice little plan coming together around that. And we will get that calendar out to all of you so that you can send that out to community members and people of what will be available. some sexual health information, will be available through that as well. Lastly, another thing I just wanted to highlight for those of you who, follow or are familiar with the Village of Fredonia water undertaking there. That is all going very well. We've been really encouraged by the response of the community. You referenced the chat that happened in Fredonia. So Jessica and Natalie were actually a part of that discussion as well. The community has been really responsive. I think it's been a wonderful approach. I can't thank Jessica and Natalie enough for just how willing they have been to go out and really message this. Jessica probably laughs, I'm sure, about like my core messaging and all these things that we want to do all the time because they love to do the science part of it. And they have just taken up the mantle of really how you know, of just really putting a wonderful, positive approach and outreach to the Fredonia thing and really stepping outside of what their call of duty really is to now also be PR people around this. And they've just done a wonderful job. Bringing it out into the public forum, I think, was helpful for a number of the community members that I've heard from, because so much of the dialogue and content was taking place behind a screen. And there were a lot of, you know, discussions and things happening. And so just we're really excited for where it's headed and the community really coming together around that.
It's one of those examples of, you know, when you think of public health, like when we did the presentation, I mentioned it briefly at the last meeting, but I started talking about what a watershed is and then moved all the way into treatment and results and monitoring and all of these things. So, I mean, it was talking about Fredonia specifically, but it was also education about water quality in general, which.
So where are we? Now that we've gone through the song and dance, where exactly are we?
The village is moving forward with their December vote plan to decommission the Fredonia plant, draw down the reservoir, and look at connecting to Dunkirk as their supplier. It takes a lot of time to put together those engineering reports, and they're trying to make a plan to pace it so that they can maximize grant funding potential. But there are also some legal petitions holding some things up. There's a group of individuals from Fredonia who have filed a legal petition. So that case was heard 2 weeks ago. So they're still waiting for the results and the final decision on what the case could or could not do.
The argument that's being made too, it's, you know, it's the past village attorney and it's people who are the actual past village administrator, the past mayor. You know, so there's some people that have some name recognition, but the concern I wonder about is simply if Judge Hanlon, I guess the case is in front of her and, you know, what she's going to rule initially, then it's other question about a permissive referendum to vote for bonding, assuming it said you can go forward, a lot of money's gonna have to be borrowed.
Well, and that was always on, like, the village was always very open with that, saying that this was the plan, that they were gonna pursue this option. And that in the future, when finances are actually being talked about, public vote will be necessary, which is why we wanted to do the outreach to try to get the public to understand.
But Rick, the funding is one thing. You're dealing with a system that is so antiquated and so bereft. It has a breakdown every couple of months and the quality, and they're on boil, and they have customers who are just fed up. They have the college there, they have the jail there, they have, you know, the
Maybe a new
school.
hospital.
Well, the
Same
whole,
thing.
yeah, and so,
Anyone who went to the
but
meeting.
this is
or
30
watched the
years.
YouTube, I mean, I said, how could anyone not believe this is the right? course
the
of
last I
action?
heard, there's 12 feet of sediment sitting in the tank. I mean, this is a tank way up there that, and the pipes, I mean, it's just constant trouble. And it's been studied 3, 4, 5, 6 times already. And the answer is always the same. You've got the world's largest water supply sitting a mile away, you know, and someone's already got a big pipe into it. This
But
is, I know.
The concern I've got is, it's like a vote about a school merger. It
I
makes
know.
all the sense in the world.
Oh, I
You go to
know.
a bonding issue,
I
and I
understand.
don't, I mean, the people I talk to think it's all a great idea. But you listen to the chatter, if I had a bet and it was a vote tomorrow, should we bond to do this? I'm concerned it'd be overwhelmingly defeated. That's my concern. It's like, did you go to the meeting? Well, 50 people went to the meeting. All right, it's on YouTube. Have you watched it? Well, no, I know I could, but
And we'll be boiling water again in
Well,
2
and I
weeks
think
and
that's
boiling
where-
water
I think
again.
that's where, to that point, we've made an effort to get out into the, because the more those conversations happen in siloed spaces and the narrative can kind of be controlled in smaller groups and behind screens and things like that. I mean, we see that every day on the internet, and, COVID was another where disinformation can now spread like wildfire like never before. So where we're really trying to call that conversation out into the community and as much of these. So again, if you all can be ambassadors for that conversation, we would appreciate that. We have a whole section on our website that people can get a hold of the Environmental Health Department and the information that they post there. It's very transparent. We really want this. There is nothing to hide. It's very clear what the system is and what it is not. We had a regional rep down from the state health department today, and I brought up the Fraternity water system, and it's kind of a laugh, a little bit of like people still think that's a viable system. I mean, it's pretty widely known everywhere. So it's just working through, and I was just talking about this the other day, actually, in regards to a lake conversation, that it's a blessing and a curse. We have a community and a county of people. We're just big enough, but we're also just small enough that there's a personality here where people really care about issues and are very vocal about it. And so that's either a help or a hindrance sometimes with what we're trying to do. And we're trying to be on the right side of those conversations and really help provide good evidence-based information.
well, you've all done a great job. I couldn't ask you more. I went to the presentation. I
Oh,
thought it
thank
was
you
just
for
so well
attending.
done.
Okay.
And I'm trying to get everyone to, forward the
Good.
YouTube address.
Yeah. Yeah, it was exceptionally done. They did a wonderful job. Thank you for supporting that effort. Thank you. Lastly, I will just say also to end on well, actually 2 more things. Preschool transportation, for those of you who don't know, we can talk about this at another point, once budget season goes around. For our early intervention children, and children who need to utilize early intervention systems and through the school system, transportation, our school districts through, the education system at the state level are not responsible for providing transportation. So the county health department, we provide that through our own funding, and that becomes a very costly expense to provide bus transportation all throughout the county, and then only to specific schools who offer those services. So with the kind of a backlog that naturally occurred during COVID in terms of children being screened and referred into these systems, now we're seeing an uptick of entrance back into those programs. So, transportation costs naturally then follow that uptick. So we are going to be looking at some creative strategies, and the state is very involved in conversations as to how they can help counties really mitigate the rising costs there. So more to come in that area. That was a whole lot of information that I supplied. I'm sorry. Any questions before we move on to just wrap up the conversation with the last part of the meeting? Anytime there's questions or thoughts. I am in that still, like I said, I'm in that 2-year phase. So this is data gathering for all your information and history into, my head. I would appreciate that. It just helps me to navigate conversations in a more thoughtful way with our legislators and our leaders. So I certainly appreciate the wealth of knowledge around this table, and would any day take any information or thoughts that you have. So thank you.
Thank you.
Doing a great job, and sprint at the beginning.
I'll slow it back down to like a 12-minute mile pace. Yeah.
Thank you, Lacey.
So Sherry's going to walk us through again. This will just be a kind of a higher level approach so that you all can see what information, again, talking about getting out into the community and really educating the community as to what the health department is and what we do. Also along the lines, what we don't do. Because that's a confusing point for some people too, like, can't my cat come in and you'll, like, no, we can't do that, right?
I'm not getting the possum out from under your porch.
Right, yes, exactly, yeah. So. You know what I'm saying?
They don't transmit rabies. They're not my deal.
But, so this is a look so that you all kind of know, the language and the dialogue that we're moving forward with, in the community and with our partners.
Yes, thank you, Lacey. So I will just start this off by saying this is about a 20-minute presentation, so I'm not going to keep you here till like 9 o'clock, but so stick with me here. So tonight we want to share with you a little bit about the origin of public health and local health departments, how they began to exist and why they exist. Whether you're hearing this for the first time or it's serving as a refresher, we hope that you will find some takeaway that will allow you to gain a better understanding of what we do here at the health department and how the Board of Health plays a role, an important role at that, to prevent disease, promote health and wellness, and protect the health of Chautauqua County's residents. The majority of the information for this presentation was obtained from the CDC and the New York State Department of Health law. Here we go. Charles Edward Armory Winslow is a leading figure in the development of the modern study of public health. His definition of public health, developed almost a century ago, is as follows: the science and art of preventing disease, prolonging life, and promoting health through the organized efforts and informed choices of society, organizations, public and private communities, and individuals. The Institute of Medicine states that the mission of public health is fulfilling society's interest in assuring conditions in which people can be healthy. Similarly, the World Health Organization, or the WHO, states public health aims to provide maximum benefit for the largest number of people. So now we will look at some historical events in public health through 4 different lenses: sanitation and environmental health, pandemics, disaster response and preparedness, and prevention and policy. So the first lens we will look at encompasses the control of disease and promotion of health through sanitation to ensure a healthy environment. Here are 3 examples of how public health has worked to contain infectious disease through environmental measures. Around 500 BCE, the ancient Greeks and Romans actively practiced community sanitation measures. Approximately 2 millennia later, the Public Health Act of 1848 was established. It provided a central Board of Health and placed responsibilities for sanitation in hands of bureaus. In 1970, the Nixon administration established the Environmental Protection Agency, which protects human health by safeguarding air, water, and land. Next, we will explore pandemics. Can anybody say COVID-19? We don't even need to talk about this slide, but we will. Pandemics are epidemics or outbreaks of disease that spread far and wide, affecting the populations of multiple continents. Influenza, or the flu, has caused pandemics many times during both the distant past and recent history. Over a century ago, the Spanish flu infected 500 million people across the world, killing up to 50 million. More recently, the flu pandemic in 2009 infected people in 214 countries, causing nearly 19,000 confirmed deaths. Historically,
Gotten better. That's
yes.
We are improving, okay.
Historically, polio was a common and highly feared disease that caused severe illness, including paralysis and death among thousands of people each year. Thousands lined up to receive the polio vaccine after it was introduced in 1955. An initiative to eradicate polio was launched in 1988 because of outbreaks in more than 125 countries. Today, polio exists in only a few countries. All reminiscing here, right?
Yeah. And Dr. Crown and Dr. Burke are pointing at themselves and over.
I stood in line, I remember. Yeah.
The good old days, right?
And that's how I started my career, was in HIV.
Oh, yeah.
So during the 80s, HIV emerged and spread rapidly across the globe. Public health responded to this pandemic by developing new ways to diagnose and treat those who are infected. New infections of HIV are down significantly, which is a sign that public health interventions are working. Currently, we're dealing on with what we hope to be the tail end of COVID-19. The WHO states there were 775 million reported cases worldwide and excess mortality of 14.9 million as a result. Preparedness and disaster response, both for natural disasters and human-made threats. The use of biological warfare to infect people and animals goes back centuries. During the siege of Kaffa in the 14th century AD, the attacking Tartar forces used plague as a weapon of war by hurling plague-infected corpses into the enemy's cities. Their actions started the first stage of the Black Death or plague among Europeans. In the wake of the terrorist attacks on September 11, 2001, public health workers were on the ground at the World Trade Center and Pentagon, conducting surveillance to identify outbreaks of disease or other possible health conditions resulting from the attacks. Public health workers closely monitor the health of first responders, city residents, and environmental conditions to detect health threats during the cleanup after the attack. Then we have Hurricane Katrina in 2005. Public health workers and other disaster relief agencies tirelessly provided emergency services. Teams were dispatched to conduct surveillance for illness and injury among people who evacuated to shelters and other places of refuge after the storm.
Just a quick interjection there too, because I think this helps with the conversation that we're just talking about. One of the questions, so actually after 2001, state health came down and had said all the counties then have to employ a public health emergency preparedness plan. It has to be written in full length. And so we do have an arm of that in our environmental health department, just so you all know that. But also it's kind of under the provision of that part of public health that in water system reports and things like that, the redactions that have been talked about, like in the Fredonia water reports, are directly related to the safety in terms of, chemical warfare and things like that, bioterrorism and things that can take place. We're actually instructed to redact those things because of safety measures so as not to make water systems vulnerable to attack. So that's something that we do get questions about that a lot. So these are the types of things that we kind of like to highlight during this presentation.
Yeah.
They're still thought to be the most vulnerable part of our infrastructure from cyber attack. They're dealing, a lot of them have software that's 20 years old.
Wasn't there just in
Oh, yeah.
Pennsylvania
Oh, yeah,
not too
I know.
long ago,
I
they
know.
hijacked
Yeah.
the water
Yeah.
system?
Yeah.
Yeah, so it is funny because at that first meeting that we went to for Fredonia, I said, if we, as public health department, we got to get water, air, land right. We got to do those things right. People kind of laughed. I was like, well, really, this is pretty basic to our public health.
Yeah.
So,
Just 2 years ago, the guy who identified patient 0 of the Spanish flu and identified the virus, he just died. Yeah, a couple of years ago, Johan Hulton, I think his name is. He died in California.
Misnomer Spanish flu.
I know it's a misnomer because it's the American flu. I know.
Yeah.
The American military base. Yeah.
Yes, I blame them.
Mhm.
Okay, next up is prevention through policy. And that is the last lens that we will look through as we view public health history. Public health works to protect, and improve health, not just by responding to disease outbreaks or preparing for natural or man-made disasters, but also by implementing policies that support these efforts on a societal level. That's supposed to see that one. As far back as 1500 BCE, Leviticus, the third book of the Hebrew Bible, is believed to be the first written health code in the world. The book deals with personal and community responsibilities and includes guidance regarding bodily cleanliness, sexual health behaviors, protection against contagious disease, and isolation of lepers. So fast forward a few thousand years, between 2000 and 2004, cigarette smoking was reported to be responsible for $193 billion in annual health-related economic losses in the U.S. Laws banning smoking in the workplace and other public places have been developed to encourage smokers to quit while protecting non-smokers from the effects of secondhand smoke. The last one, more than a third of U.S. adults and approximately 17% of kids aged 2 to 19 are obese. Those figures might be slightly off because they're a little old. Efforts to highlight fat, sugar, and salt content in foods through labeling regulations have been developed along with the promotion of physical activity in schools, workplaces, and neighborhoods. The next is a public health approach. We look at what has worked in the past in addressing a problem and if a proposed intervention makes sense with our affected population. So the public health approach is ultimately identifying the problem and responding to it. We conduct surveillance and look at risk factors to determine the cause. Then, through intervention and evaluation, we figure out what works and respond through implementation. In the last step, we ask, how can we implement the intervention given the resources we have and what we know about the affected population? Will this work? Here is a historical example of an infectious disease. During the early 1800s in London, cholera, a fatal intestinal disease, was rampant, causing death to tens of thousands of people within hours of the first symptoms. At the time, which was before bacteria and viruses were recognized as the cause for many diseases, popular opinion was that cholera was caused by bad air coming from rotting organic matter. Then comes along John Snow, a British physician who had a different opinion about cholera. He believed that the illness was spreading by way of a contaminated water supply because sewage was routinely dumped into the Thames River in cesspools near downtown wells. Because of his work tracing the source of cholera outbreak, he is often considered the father of modern epidemiology. His research changed the way we look at disease. Now, let's apply the public health approach to Snow's research of the cholera outbreak. What was the problem? Snow conducted public health surveillance by looking at where those with cholera lived in London. He saw that larger clusters of cases were occurring in specific areas. The red circle depicts the neighborhood in question, and the black dots represent the deaths from cholera. Snow worked to track down the interview cholera victims and their families and map out the outbreak. Next, he examined the data, tried to identify risk factors. That is, he tried to determine the cause of the deaths by using the pattern of where cases were occurring. So this slide illustrates the location of the water pumps, which are indicated as black boxes. On the basis of his previous work, Snow believed that water was a potential cholera source. The map reveals the largest number of cholera cases occurred in areas near neighborhood water pumps. This prompted Snow to research the distribution of water pumps in London. He identified where people who had cholera were drawing their water. His findings indicated that clusters from cholera cases were more commonly located around certain pumps, particularly the Broad Street pump. Through his research, he concluded that drawing water from the Broad Street pump was the primary risk factor. So after identifying the likely risk factors, the next step in the public health approach is evaluating potential interventions. What interventions will work? With the water supply from the Broad Street pump identified as the risk factor, Snow worked to identify interventions to address the problem. Through continuous research, Snow understood that the interventions required to control the cholera outbreak needed to stop exposure to the contaminated water supply on a larger scale and stop exposure to the entire water supply of contaminated water or supply of water that was contaminated in the area. Using the final step of the public health approach, Snow implemented the intervention by removing the pump handle from the Broad Street pump, so no one could continue to draw water from the contaminated water supply. So after a long battle with the politicians and water companies, he finally convinced the British government that water contaminated with sewage was the source of the cholera and other diseases, which resulted in the implementation of policies and laws for water sanitation. And I think if only it were that simple, but I can imagine back then it wasn't as simple as we think it might be. Okay, moving along. Topic 5 is partners in public health. The field of public health is broad. Beyond government, it requires stakeholders with skills in intervention, programs, policies, research, evaluation, and education. Community-based organizations, or CBOs, play a key role in public health. CBOs serve many different purposes, from advocacy or education to emergency relief and economic development. Healthcare plays a vital role in protecting and promoting the public's health along with public health organizations. While public health focuses on populations, clinical healthcare focuses on the individual patient. Media, where we deliver health education, promotion, and communication through news and other media outlets like social media, radio, newspaper, and so on. Employers and businesses, through employer-sponsored health insurance programs and wellness initiatives and encouraging healthy workplaces. Government agencies, local agencies like planning and development, other human services agencies, municipalities, as well as state and federal agencies. And education and training to include research and public service. So to recap, we need to work together with the community as a whole in order for the public health system to work as it is intended to. Next, we'll talk about determining and influencing the public's health. Certain factors determine a person's state of health. Scientists generally recognize these health determinants for any population. Some specific examples of health determinants are genes and biology, like sex, age, genetic makeup, health behaviors, smoking, eating habits, physical activity, stress, and mental health. Societal characteristics like discrimination because of income or sex, where a person lives, including things like air, water, and sanitation quality. Medical care, quality health care, insurance coverage. And other items could be like level of education achieved, income level, parenting, race, ethnicity, quality of the surrounding built environment, quality of schools, ability to work. I'm sure there are many others. This chart is an estimate of how these 4 major determinants influence health at the population level. Notice the portion of the chart that represents medical care. We spend trillions of dollars on healthcare, yet it only determines about 25% of our health. The remaining 75% of what determines our health as a population is our total environment or ecology, including the social environment where we live, our health behaviors, and to a lesser extent, our genes and biology. An example of the role these determinants play in our daily lives is through nutrition and physical activity. Both are essential elements in producing optimal health and should be viewed in the context of such environmental factors as social and cultural norms that influence food choices and physical activity, environmental characteristics like availability. Think of lack of healthy food, open spaces for exercise, or safety in neighborhoods, and influences such as marketing of processed food. All of these factors influence our individual choices, which in turn can have a huge effect in our overall health. All of this information is important to know, but I saved this section for last because we want to stress the importance of learning about our 4 mandated services and essential services and how they relate to the functions of the Board of Health. As the local health department, we cannot facilitate all that falls within the broader framework of public health. Instead, we are the functional local arm of the state's public health law and are tasked with utilizing our state allocated resources to approach the highest priority and very specific population health problems. The following are broken out by New York State Department of Health in the 6 core mandated services that we must follow in order to receive our state aid. This is written into the New York State Public Health Law. Family health. The local health district department is mandated to improve the health of persons under the age of 21, including children with special health care needs, increase the number of people under age 21 who receive comprehensive well-child primary and preventative care, including oral care health, as we were just talking about, improve birth outcomes, and improve reproductive health. So some of our programming around this topic are Welcome Baby, breastfeeding support, early intervention and preschool, children and youth with special health care need programs, immunization, and condom distribution programs. So as you all seen, we've included our annual report, shows a recap of 2023, but also in the report will detail, just the basic information on our programs that we do offer here at the health department. Communicable disease control, which shall include, so this is public health law, communicable disease control, which shall include activities to control and mitigate the extent of infectious diseases, specifically STI, STD, and HIV, tuberculosis, through immunizations, and provide disease surveillance and investigation. Chronic disease prevention. The local health department shall maintain a program designed to reduce the prevalence or incidence of chronic diseases and conditions like cancer, cardiovascular disease, diabetes, asthma, arthritis, obesity, and underlying risk factors of tobacco use, physical inactivity, and poor nutrition. Much of how we are doing this is through our public health education, marketing, and communication efforts. We are mandated to work with community partners to conduct a community health assessment and community health improvement plan. The assessment will include the current health status of the county and identify factors that are contributing to these health issues. We also identify priority areas for health improvement, as well as services and resources to improve the health of our residents. We work with folks like local hospitals, other human services departments like Office for Aging Services, mental hygiene, and social services. Community partners like the Chautauqua Center, the Resource Center, the Chautauqua Health Network, and Prevention Works. We take the data and devise a community health improvement plan consisting of actions, policies, strategies, and measurable objectives that the health department and community partners will address and track progress towards improvement of public health outcomes. The most recent copy of our community health assessment and community health improvement plan is available on our website. It's 180 something pages long, so we didn't print it out for you, but you can certainly, check that out on the website.
Just a quick addition to that.
Yeah.
The state is looking at very recently, this is kind of new news for all of you. The state is looking at and is revamping the community health assessment process thing. So those of you who are familiar with that process, that will be changing. It was typically a 3-year process. I think now it will be a 5-year system. They're looking at trying to streamline it more so with the hospital systems because there was some kind of disjointedness there in the past things. So this will be a group that we will keep very much involved with the integration of that new health assessment process.
Next, we have environmental health. We are mandated to promote health and prevent illness and injury by assuring that safe and sanitary conditions are maintained at public drinking water supplies, food service establishments, and other regulated facilities we hear about very regularly at our Board of Health meetings. Also, investigate public health nuisances to assure abatement by responsible parties, protect the public from unnecessary exposure to radiation, chemicals, and other harmful contaminants, and conduct investigations of incidents that result in illness, injury, or death in order to identify and mitigate the environmental causes to prevent additional morbidity and mortality. Some of the programs we manage are inspection services, drinking water, sewer systems, property transfer inspections, lead poisoning prevention, and rabies mitigation. Emergency preparedness response. As Lacey was alluding to earlier, that is one of our 6 mandated services. The local health department shall conduct a program designed to ensure readiness to respond to health emergencies, whether naturally occurring or deliberate, to protect the health of its residents. So those are the 6 mandated services. And then along with that are essential services. So the local health department must incorporate the following into each of the 4 mandated services: ongoing assessment of community health needs, education on public health issues, development of policies and plans to address the health needs, and actions to assure that services necessary to achieve agreed upon goals are provided. Next, we will look at a couple of examples of how essential services are played out in the government processes. So assessment, policy development, and assurance are carried out at all levels of government, federal, state, and local, for the overall public health system to function as it was meant to. So let's take a look at the policy development. At the federal level, so these are just some examples here, smoking was banned on commercial flights. At the state level, they increased the tobacco tax. At the local level, this was actually here in Chautauqua County, passed a local law where we became the first county in New York State to increase the legal age to purchase tobacco from 18 to 21. This happened more than 3 years before New York State implemented the statewide Tobacco 21 law. This started at the Board of Health and then was passed by the legislature. Another example that we developed is that we developed rules and regulations on our local sanitary code regarding tattoo shops well before New York State implemented their oversight.
They still haven't.
Oh, I still have.
New York State doesn't have a code for tobacco, for tattooing.
Okay, I thought we did some sort of change to our sanitary code, but that,
And other counties did pick up the model and other county cities.
So we're still ahead of the curve.
We're still out of it. We're still out of it.
Rochester, Monroe County has absolutely no regulation for their tattooing shops and artists.
I remember taking my daughter who wanted a tattoo to a tattoo place in Fredonia. And the guy looked at her name, looked at me. He must have changed his glove 16 times. It was so funny to watch. I mean, he just kept changing his glove. Oh my God, was it funny? Oh, hey. Hey.
He's aware.
Yes, he was. Yes, he was.
That's all we can ask for.
Yeah, hey.
and as Lacey mentioned earlier, and you all see, we have included a copy of our sanitary code for you to take with you for review before our next meeting. So at our next meeting, we will talk more about our sanitary code and the authority of the Board of Health. So we'll look into that. But lastly, we are so glad that you're here and appreciate the work that has been done in the past through this board and look forward to more of the same in the months and years to come. So thank you, Board of Health.
Yes.
Great.
So there are iterations of that. Of course, so much of that and not all of it is not new to this group. But again, we're hoping that you will be ambassadors as you have been and continue to be that in the community. So, these are things that we're trying to highlight again, because a lot of times people just view us as this is just another overreach of the government to come in and do these, so we really try to provide real-time examples and real-time context as to why this affects, the lives of everybody in this county. And we're going to actually get some FaceTime with our legislators. We're going to go and ask to be a part of some of the different committee meetings, provide this information, as well as, again, we tailor it to some of the different groups, or Sherry tailors that, I should say. Also with our partner agencies, our other human service agencies, mental hygiene, social services, OFAS, emergency services, jail, get in front of them and really help them understand that they are a part and portion of certainly our public health system. If you have, again, even about this, any questions or additions or things, ideas that you have, we would love to hear them. Otherwise, we are about 20 minutes ahead of schedule. Again, we're working at this, this time frame thing. We're doing really great. I'll turn it back to Dr. Kidder.
Okay, is there any other business to be brought to the meeting? Down there, Wolf, anything you got? No? Okay, can I have a motion to adjourn?
Move.
I'll second.
Dr. Pender seconds, great.
It's a matter of Robert's rules. So
Yes, what
you
did
don't
I
need a
forget?
second on a motion.
On
to
the
adjourn.
motion to adjourn?
Right, yeah. Just that
You're
one.
gonna have to remind me of that every meeting.
That's all right.